Hi, we're interviewing Tamara Zablocki today, the founder of the Symptom Journal and the inventor of the Symptom Journal technology. Tamara, who can benefit from a Symptom Journal membership?
I think anyone that considers that they may have a chronic disease, someone who's in the diagnosis process, someone who is newly diagnosed, or someone who is living with a chronic disease and trying to live the healthiest life they possibly can.
What benefits can someone obtain from being a Symptom Journal member?
Symptom Journal really allows you to understand the cause and effect between your symptoms, your daily lifestyle and health choices, your treatment, your nutrition, and your health outcomes. And it really allows you to save time, money, and energy, which is really important when you're sick and trying to find out the answers to your health puzzle.
How much time and what's involved in doing the Symptom Journal process each day?
We've done a lot of the hard work for you, and it only takes 2 to 3 minutes a day to answer your daily questions. Input what you've eaten for the day in the nutrition module, and then once a month you answer your monthly questions, and it takes a couple of minutes to run a report and print it and generate what you want to see.
When did you first think of using journaling and symptom tracking?
You know, it was a while ago. When both of my sons were young, they had multiple health problems. We couldn't figure out a lot of what was going on, and the pediatrician had lots of questions. And I just knew to start tracking everything that was going on in their lives, whether it was their symptoms, what they were eating, their gastrointestinal problems, learning challenges, and I was able to put the puzzle pieces together and give their pediatricians really good, consistent data, which allowed for some really breakthrough decisions being made and allowed both boys to have better health choices happening and greater health outcomes.
What results have you seen in using the Symptom Journal process?
Well, you know, not only with my own kids did I see what the Symptom Journal can do, but then when I got sick 12 years ago, I just naturally gravitated to using the Symptom Journal technology and actually refined it and perfected it and fine-tuned it and used it for myself because there was nothing but questions when I got sick. I mean, I went from being a vibrant, healthy young woman with lots of energy, running 2 to 3 miles a day, maybe a little bit of an overachiever, to someone that was in bed, sick, migraines 24/7, you know, absolutely reacting to every food and every incident in my life. And I felt like I really needed to get me back. And I think that's what happens to a lot of people with chronic conditions is, you know, they remember what it felt like to be healthy. And, you know, I realized how much I took that for granted. And I really wanted to get me back, the healthy person. So I kept track of everything, every symptom, every bit of information that had to do with my treatment plan, everything that my doctor asked me to track, and then some of the things that I thought of. And I was able to deliver to them really timely, consistent information that made a world of difference in the choices that we were able to make. And today, my symptoms are 90% abated. I have renewed energy, and it's something that I wanted to share with the world, a technology that can really make a difference in people's lives.
Wow. So what motivated the creation of the Symptom Journal technology?
I think it was seeing the differences it made in my son's health choices and their educational choices, my complete health turnaround, and then talking with doctors and sharing with them the technology that I was considering making available to the world, and them explaining their challenges with getting consistent data from their patients, and that they really couldn't make better choices than the data that they were given. So, and the challenges that patients have, putting together the puzzle pieces when it comes to their health and connecting the dots. So I knew we were really onto something, and I brought together a team of wonderful women to put together the Symptom Journal and make it available as a web-based technology that could help people with chronic conditions anywhere in the world that internet is available.
What resources will people find at the Symptom Journal website?
You know, we have comprehensive information from everything from the description of the disease to its cause, its risk factors, the diagnosis process, the tests that you might go through, to the treatment, alternative treatment, nutrition, and also resources and support that are available. And at this time, we have 15 different disease profiles at the Symptom Journal website, ranging from ADHD to Asperger's syndrome, autism, anxiety, bipolar, depression, fibromyalgia, Graves' disease, Hashimoto's disease, hypothyroidism, migraine disease, multiple sclerosis, and rheumatoid arthritis. We have our daily and monthly questions, a fully integrated exercise and nutrition program, And I think where the really amazing part of Symptom Journal comes about, the real power of the technology, is in the reports where you get to see how all the cause and effect and all the dots line up when it comes to a choice you made on Tuesday creating a reaction or an outcome on Wednesday or Thursday. I mean, it's just amazing to see. We also have a complete friends network that allows you to connect with other people and puts the power of social networking together with that of people with chronic health conditions. And then we have a complete discussion community. And then something that I'm very proud of is we realized one of the toughest things for people with chronic health conditions or parents of kids with chronic health conditions was keeping motivation, keeping inspired. There's times when you get down and you don't want to keep going. And there's tools and there's support and there's information and there's exercises to help you when the going gets tough and to really help you be strong and keep going in your health journey.
Your passion and commitment for the Symptom Journal are evident. What are your hopes and dreams for it?
We hope to reach hundreds of thousands of people with chronic health conditions. You know, we're a patient-by-patient site. We don't have any advertising or any physician content. We're a membership site. And this has been designed for patients to help them solve their chronic health conditions and live their best life. And that's what we hope to do for people, is to give them empowered choices and new opportunities and a chance for healthier tomorrows.
Thank you for your time today, Tamara.
Thank you very much, Bob. I want to have everybody go to www.symptomjournal.com and check out our 1-week free trial. You have nothing to lose and everything to gain, and we want to help you live your best life. Thank you.